So, what we are going to do today is the individual bone identifications in the cranial bones, and the detail of things which is related to this particular cranial bones is not required. Muscle attachment is less, but it has got a lot of features, grooves and sulcus and foramens, etc., which basically transmits neurovascular structures. So, which are exam questions of course, but largely individual bone have got like a lot of complex features. Nowadays in this NMC curriculum we do not have that complex feature to be memorized in detail, but we have to have a salient feature identifications of individual bones. So, first thing is that like we have to identify the views whenever you are looking at the skull, the way you are looking we call them as norma, and that particular norma, if you are looking from the front side we call them as norma frontalis, from the side lateralis, posterilis, occipitalis, basalis, verticalis, etc., that is what we are familiar with. So, that with that view whatever the things you are seeing basically that is the bone narration, that means frontal bone, maxillary bone, nasal bone, etc., mandible, whatever seeing in frontal. So, whatever the things or whatever the cranial bones we are seeing, that is been with the norma we are going to describe. Now, cranial bones can be divided into two parts, which is covering the brain, neurocranium, neurocranial bones and facial bones. They are divided into two segments. These are the basic nomenclature, and this particular cranial bones have got two tables, outer table, inner table. In between we have a space, we call them as diploic space. If you just like cut this particular cranial bones, we will find between the outer table and inner table a space, marrow space, we call them as diploic space. Diploic space is pierced by some veins or vascular structure, we call them as diploic veins, which is basically communicating with the external veins with the internal veins of the cranial system. Now, individually this particular bone is one of the easy bone, and many a times it been asked in examination to identify this particular bone individually. So, for the day we are going to talk about this particular bone, we call them as frontal bone. Separated out, if it is, we have to know the general features, parts of this particular thing, not very detail of it, and muscle attachments which is present to it. And again we are going to talk about this particular bone which is lying in front of the face, we call them as maxilla, which is having this midline presence with it. We will be talking the general features of this particular bone, not detail of it. Little bit detail of this particular bone, muscle attachments, we will be referring to this particular bone. So, it is one of the easy bone to talk about. Now, first thing is, whenever you are given this particular bone, this is a frontal bone which is coming on the frontal side, visible on the fronta, norma frontalis. So, this particular bone have got two parts, this part which you are seeing here present, which is known as squamous part, and then we have this orbital part which is present in this horizontal part, which have got plates which is making this roof of this orbit, this one, and this is orbital part having this orbital plate, and this is squamous part. In between them we have this part, in between this particular notch we call them as nasal part, which is present inside, which is making the root of the nose. This particular region between this particular notches we call them as like nasal part, and continue down to the nasal part going backwards we call them as this part which is related to this sinus, we call them as ethmoid air sinus. So, this part we call them as ethmoidal part. So, basically 4 parts of this particular bone that we have to identify. One is squamous part, then orbital part which is present in here, and the third one which is a nasal part in between these particular notches, we call them as nasal part. Nasal part continue down to this particular bony groove which is continuous with this orbital bone, alveolar bone. We call this alveolar bone or alveolar sinuses which is attached to it, we call them as alveolar part or alveolar process. Now, talking about this particular like a squamous part, as you are seeing here, this particular squamous part which is present on this side, this particular squamous part which is has a bony plate to the side have got prominences over there, we call them as frontal prominence, which is one of the prominent right side and left side. So, in between the frontal prominences we have a depressed narrow part which is going down, then we have this particular groove or arch, we call them as superciliary arches. So, this particular arches is representing the area of the ear brow. So, ear brow is present on that, this is basically representing that particular part. A little down on this particular frontal prominence that we have in all humans, which has got holding this particular frontal lobe of the brain deep to it. So, under to it we have this superciliary arch. Superciliary arch meets to the midpoint, we call them as glabella. So, this particular point we call them as glabella, Glabella. So, the glabella is a kind of midpoint which is meeting of this particular two arches, we call them as superciliary arch. Then we have the supraorbital margin that we are seeing here, this particular making the roof margin or roof chamber of this orbit. So, we call them a supraorbital margin which has a notch inside to it which may be transmitted into foramen. We call them a supraorbital foramen or supraorbital notch can be converted into foramens which transmit in neurovascular structure. We call them as supraorbital nerves and vessels. So, coming to the squamous part, the features which is related to it, frontally we have these two elevation, we call them as tuberosity, frontal tuberosity which is present, also known as frontal notch, and then we have the superciliary arches which is meeting in the midline, we call them as glabella. Glabella with a neurological examination, if you are doing in neuroscience or no, in physiology, they go for a reflex test, we call them as glabellar tap. So, if you tap this particular glabellar region for the newborns, there is a blinking of eyes which is represented as a glabellar tap or glabellar tap reflex. So, that particular point glabella is given for the surface marking in exam as well during the cadaver identification part as well. So, this frontal eminence or frontal prominence which is you are seeing here right to left, then superciliary arch, then supraorbital margin which has got like an in notch, supraorbital foramen when we converted because of some ligaments or tendinous structure going through it, and then we have this particular nasal part which is going down over this region. So, where we have the nasal bone articulated to it, then we into it we have this particular bony part which is between, then we call them as ethmoidal notch or nasal part continues to this particular ethmoidal groove or ethmoidal notch which is a U-shaped structure, and into here we have some cells attached to it or some cavernous osteoid bodies are attached, we call them as ethmoidal air cells or ethmoidal air sinus. So, that ethmoidal air cells or ethmoidal air sinus, there are many like look like soap bubble appearance having got like the bony bones which likes a soap bubble, and that particular cavernous sinus is extending into this particular deep to this particular nose or deep to the nasal cavity which is a kind of like an extension of the nasal cavity, we call them as paranasal air sinuses. So, this paranasal air sinuses will be having a class on it. So, that particular paranasal air sinus which is known as ethmoidal air sinus or ethmoidal air cells, they are basically attached to these particular bones and they are very tiny, thin walled and fragile bones or bone sets that is present. So, this is the general part of it. Now, coming to this particular orbital part which you are seeing here having a notch, supraorbital notch and a supraorbital margin which is going to it, midline it is meeting in the midline which is known as the nasal notch which is extended below in the U-shaped ethmoidal notch. Then we have this particular plate, we call this as orbital plate. This orbital plate basically makes the roof of the orbit. So, whenever you are holding this particular bone anatomically, this is not the anatomical position. The anatomical position is that this orbital plate has to hold in horizontal position. That means, this should be head like flat, this should be go by the floor. So, you hold this particular bone orbital plate like this and then dip it down till you make this particular bone horizontal. So, you have to make this particular orbital plate horizontal. So, they are basically by the plane of the floor. So, this is orbital plate because this is the roof of the orbit and you are holding that in anatomical position, clear. So, this anatomical position of frontal bone, that what you have to know or that what we have to correctly position it. So, this orbital plate has to be held in this particular posture, we call them as horizontal position. This particular frontal prominences which is known as tuberosity which is should be projected front and superciliary arches which is going down, supraorbital margins should be facing forward and this notch which is present on the anterior side and this squamous part should be facing upside. So, this squamous part is facing upwards. So, this is how you should be holding in anatomical position, right. So, this is the anatomical position of this particular bone, that what you have to see. Now, interior to it, if you can see this particular interior to it, we have this particular midline point over here, we have a foramen, we call them as foramen cecum. From this foramen cecum, we have a groove which is going down, which is for the lodgement of a venous channel in the brain, we call them as superior sagittal sinus. The superior sagittal sinus is covered or wrapped around by a dura mater fold, we call them as falx cerebri. So, that particular falx cerebri with this superior sagittal sinus, which is a venous channel in the brain, which is present in the midline of this particular bone. Now, coming from this particular orbital plate, moving to the side over here, we have this particular process which you see here projected towards this side. We call them a zygomatic process, which attaches to the bone, zygomatic bone, which is cheekbone attaching to this zygomatic process, that particular bony part. This is what we call them as zygomatic process. So, this is arch over here. Zygomatic bone has a frontal eminence or frontal process which fits into it. So, this zygomatic bone which is attaching to it, so we call them a zygomatic part of this particular frontal bone or zygomatic notch, which attaches to this particular cheekbone, zygoma or zygomatic bone part, which is a body, and this part we call them as arch of the zygomatic bone. This part we call them as body of it. The body of zygomatic bone is bridged with this particular bone, we call them as maxilla. So, this is a maxilla that we are bringing out here. So, this is how this whole architecture is fitted with. Now, they are fitted with this particular joints in between them, and this particular bone which is uniting with this particular bone make an articulation to it. Other than this, the bone, frontal bone is making an articulations over here. We have this particular bone, we call them as parietal bone. So, this parietal bone, right side and left side, two of them are there. They are making a joint with this particular frontal bone in this particular point. So, we call this particular union point over here, we call them as Bregma, Bregma, right. So, this particular point we call them as Bregma, and if you just like cut this particular human body sections through this particular plane, we call them as sagittal section, and the sagittal section is coming because of that particular vein which is present deep to it. We call them as superior sagittal sinus, which is present strictly in the midline. Which midline? This midline following this particular bony notch where we have this vein placed in. So, this is how this particular whole narrations of the thing is there. So, what you are expected out here, you should be able to identify this particular bone, you should be able to hold this particular bone in normal anatomical positions, keeping that particular reference frame of this orbital plate placed in horizontal positions. This particular prominence, we have to know about this particular prominence, we call them as frontal tuberosities, and we have to know about glabella and superciliary arch, supraorbital margin with this particular supraorbital notch fits into it, nasal part, this alveolar part, and this ophthalmic this particular squamous part which is facing upwards like this, and this particular point we call them as zygomatic process which is articulating with the zygomatic bone. Now, deep to that we have this particular line which is present to it, we call them as temporal line. So, this line which you are seeing here, below that we have that temporal fossa which is lying below to it. So, this particular zygomatic bone and this particular region, this region we are referring here, which is above this or in the lateral extreme of this particular bone which is present to it, we have this muscle attached to it, we call them as temporalis. So, this particular muscle attached to the side, so of this particular on the lateral side of the zygomatic process, we call them as temporal fossa where the temporal muscle is attached. So, this part we call them as temporalis muscle attached to it with the covering, we call them as temporal fascia, and then we have this particular area we call them as temporal fossa, and this line we call them as temporal line which is present as a mark over here. In the front we have a muscle which is attached to this part, we call them as frontalis muscle. Frontalis muscle is continuous with the back side with the muscle, we call them as occipitalis muscle. They share a common belly or share the common tendon, we call them as occipitofrontalis. That means a muscle in the front, frontalis, a muscle in the back, occipitalis, in between a shared tendon, we call them as the common aponeurotic tendon of the occipitofrontalis. So, occipitofrontalis ranging between front to back with a shared tendon in between, occipitofrontalis, and because of this particular occipitofrontalis which is present in this particular region, occipitalis muscle, which is a muscle of facial expression which is supplied by the facial nerve or cranial nerves number 7. So, this is about in short about this particular bone, which is important rather to identify this particular general salient features of the two muscles, two attached over here, and this particular general features of this bone that you must identify along with this particular view, in which view we can see this particular frontal bone and what are the basic parts of this particular bone, muscle attached, two of them very easy to memorize and remember, and this particular bone making an union of this particular point we call them as Bregma, which is with these two lateral bones, parietal bone right side, left side, and the frontal bone meeting in the midline, we call them as Bregma, this particular point. This particular point Bregma in the before it unites, this is an adult bone or skull you are seeing here. At this particular point, this union takes place at time. When we are born, this particular union is not there, it is not formed. So, it is covered by a membrane. So, that particular membrane ossifies and this particular thing becomes bone. So, this particular point over here looks like a diamond shaped gap. That particular gap we call them as fontanelle. So, that particular fontanelle, as it is present in the anterior part, we call them as anterior fontanelle or anterior fontanelle. So, that particular anterior fontanelle has got clinical importance, significance, because this is still have got like a bend covering exposed and that particular part. So, we can just like touch this particular meninges. If you touch this particular newborn in this region and it appears soft. So, this anterior fontanelle and posterior fontanelle, they are for importance for the physiological examination as well. So, they teach about the fontanelles when they teach about CSF circulation and the intracranial rise of the cerebrospinal fluid pressure. So, this is about the frontal bone. Now, coming to a little complex bone which is present in this particular front region or face region, which is a facial bone. This one is a cranial bone because it is covering the brain. This one is not related to the brain, yet it is a facial bone which is present to it, has a amorphous size, do not have any size. These two as well do not have a specific size, right, or shape. So, this one as well have got like few features that you have to know. So, this part of this particular bone have got two important things that we must identify. So, this is the main part of this particular bone, we call them as maxilla, which is forming the upper jaw. So, where the teeth are there. So, pretty important for us to identify this particular bone, have got a body which I am holding with the hand. So, this is what we are holding with the body which is present in it. So, it is kind of pyramidal shaped or kind of square shaped a body which is present, right. Now, this particular body have got projections, two different sides, just like the vertebrae we have the projections, this one also have a projection. This one you can see that projected upwards. This is moving up and going up to articulate with the frontal bone. So, we call this process as frontal process, right. This one opposite to it going on the downside where the tooths are there, we call them as alveolar process. So, above frontal process and this one is alveolar process where the tooths are there, right. So, upper jaw teeth are placed in this particular region. And then we have the process which is this one, which is present to this side, which is the zygomatic bone is attached to it. So, this is a maxilla and the zygomatic bone is attached to this particular bone, we call them as zygomatic process. So, which the zygomatic bone is attached to it. Then we have this particular process which is related to the nose, we call them as nasal process. So, this notch which you are seeing here, this nasal notch and this particular part we call them as nasal process, and as well this particular area forms the roof of the mouth. That means, this region which you, if you flip it, we are basically getting inside the mouth cavity, oral cavity. So, we call them as palate bone, palate, this is a hard palate that you are holding. So, this is one we call them as palatal process. So, 4 process or 5 process that can be identified. One is up frontal, one is to the side zygomatic, one is to the nose side nasal process which is through the nose side forming, and one to the hard palate we call them as palatile process which is making a bone which is palate bone which is there. So, this particular bone is placed basically in important regions, where important there. So, this particular upper part of this particular bone basically forms the floor of the orbit. So, orbit has a roof which is formed by this particular bone, this is the roof. So, orbital plate which is forming the roof. So, orbit has a roof and a floor. So, roof is formed by this bone. What bone is this one? Frontal bone, this plate, orbital plate, and it has a roof where this particular eyeball is placed. So, roof part of this particular orbit is formed by this bone. So, this particular bone which is this maxilla, this is the roof part which is the frontal process which is going up, ending to this or anchoring to that particular part, we have a flat bridge of bone very thin, we call them as floor of the orbit. Now, if you go down to it, lower part of this particular body, we find this particular another vertical, another horizontal projections like this. So, this is basically forming the roof of the mouth. So, this bone is placed basically between the orbit and the oral cavity. So, if you remove this, if you have a damage to this particular bone, the food can enter from the mouth to eyeball or orbit. So, there is a disease or any kind of defect, if it is having with the maxilla, if you have a bone tumor or something eroding this, so eroding the palatal process, you are ending from the palatal process. If this palatal process is broken, then what happens? You are chewing the food that can enter to the eyeball or orbit. So, this is a very important bone in that respect. Now, between this particular orbital plate and the palatine plate, we have the body of this particular bone existing, which is present here, and in between the body it is hollowed. So, it has a cavity towards it. So, this cavity inside this particular bone we call them as maxillary air sinus. So, this space we call them as sinus. So, what this sinus is doing? This sinus is communicating with the nasal cavity. So, our nose, which is present into it, right side nose, left side nose, we have a cavity of nose. The cavity of the nose have got expansions, just like moving or encroaching to the nearby bones. That expansions of the nasal cavity we call them as sinuses. As these sinuses, which you are referring here, related to the nose and they are on the sides of the nose, we call them as paranasal sinuses. That is why we call them as, in short we call them as PNS, paranasal sinuses. So, we have the nasal cavity. Into this nasal cavity, if you move right, up, go down, go posterior, you have expansions. So, a kind of a blind expansions or blind pouches are there. Those blind pouches, they are eventually draining into the nasal cavity. So, those expansions of the nasal cavity to the nearby neighbor bones, we call them as sinuses. Those sinuses we call them as nasal sinuses, and these nasal sinuses are related to the nearby nasal bones. That is why we call them as paranasal sinus. In short, we call them as P and S, right. So, these paranasal sinuses are all of them, that is what you are referring. So, this one of the paranasal sinus, we call them as, within this maxilla bone, we call them as maxillary sinus or maxillary paranasal sinus, but we do not use the whole like whole name and surname, all these things. We just mention that maxillary sinus, but maxillary sinus means maxillary paranasal sinus, clear. Now, the same sinus exists in this particular bone. What bone is this one? Frontal bone. So, we call them as frontal PNS, paranasal sinus, but in common words we call them as frontal sinus or frontal air sinus. The same sinus, if it is extending backwards to this particular orbital plate, in between the orbital plate we have the ethmoidal bones. So, we call them as ethmoidal paranasal sinus. In short, we call them as ethmoidal sinuses. If this particular sinus is extending to other bones, what bone they are encroaching or what bone they are going in, we name that accordingly, clear. So, these are paranasal sinuses. What they are? Expansion or blind expansion. That means, with the paranasal sinus, the air cannot escape out of this nasal cavity. They go there and roam and come back. So, this particular nose, if you measure it, or the cavity of the nose, if you measure it, like if you have a length and the breadth and the depth, if you measure it, we get the 3 dimension in cubic meters, it will be short. But with this paranasal sinus present, this particular nasal cavity space or cavity spaces is enlarged. So, what is the use of this particular paranasal sinus having it? So that air which you are breathing in can flow between the sinuses and ventilate that part. So, as this particular thing is going through this ventilation process, the air are filtered. So, these paranasal sinuses have got mucus lining on it. So, this air which you are breathing in going through these various channels to the sinuses, and their mucus or mucus coating cells or mucus lining areas, they are brushing these dirts, whatever the molecules, whatever the things that is present within this air before it gets into the lung. So, it is basically trapping the air, cleaning it, moisturizing it or demoisturizing it, depending on making this particular air suitable for us before it enters to the lung. So, this is the function of it, and as it is going down and up, it creates or adds the resonance to the voice. So, this particular sinuses we call them as resonating or creating voices. So, this particular paranasal sinuses development creates this voice that we are seeing, that is the voice we are making. The singers, all the performers, they have this particular paranasal sinuses, they use that for different purpose or different ways to generate different kind of sounds. So, vocalist, not only the larynx which helps us, this air that is trapped within the sinuses helps us to produce the voice. But anyways, coming to it, so beside this particular body, beside this particular process that we have to know the how to hold this particular bone anatomically. So, basic thing is holding this bone is anatomically, you have to know this part, you have to know this is the body which has a cavity to it. This bone, name of this particular bone is maxilla. So, this particular cavity of this region we call them as maxillary cavity. The maxillary cavity we call them as air sinus, which is the empty space which is present, we call them as maxillary PNS, maxillary sinus. So, this maxillary sinus present within the body and it has got process. How many of them? If you forget, does not matter. You have to know this one which is projected up like a poster above, we call them as frontal, which is going down to the frontal. Opposite to the frontal which has the tooth, we call them as alveolar. So, this is up, this is down, clear? Now, then we have to find the nose. Nose is on the medial side. So, this one is on the medial side and cheekbone is on the lateral side. So, this is zygomatic process is lateral and nasal one which will be on the medial side. So, this is how we are going to have this particular bone anatomically held, right and left depending on how we are holding it. So, this is right side bone because of this particular frontal process is present in here. Now, how we are going to hold that particular, like making the axis of it, this particular part we call them as palatine bone, that means holding this particular palatal process. So, this particular palatal process you will be holding in vertical because palate is more or less vertical in position. So, this palatal bone is vertical in position, nasal notch which is making over here, and this particular zygomatic notch should be directed posterior and little bit lateral. Posterolateral you are placing it, then you are holding it in an appropriate hand, right side right hand, left side left hand, right. Now, individual descriptions of this are plenty of them. So, I do not think you will be able to like comprehend all those things because it has got like a surfaces like anterior surface, this one is posterior surface, this one is medial surface, this one is lateral surface. So, posterior surface is having two parts, this posterior part and posterolateral part, and inferior one which is you are seeing here is the orbital plate. So, the surfaces are there accordingly. Now, one thing I want to mention out here on this posterior part or posterior surface, this is the anterior surface of this particular bone, opposite to it we have the posterior surface. Posterior surface have got two parts, this is towards the zygomatic bone, lateral, posterolateral and posterior medial, right. So, this is towards the medial side, nasal side. So, on the posterior medial side which you have a large opening present in here, which is opening the cavity towards this sinuses. So, this opening that you are seeing here a little bit in like enlarged or little bit broken over here, this is the opening of this maxillary air sinus. That means, this maxillary air sinus is communicating with the maxillary cavity of the sinus with the nasal cavity, right. As we have mentioned, this nasal cavity expansion is going into it. So, this particular cavity of this particular maxillary sinus is communicating with the nasal sinus through an opening we call them as maxillary antrum or maxillary opening of the maxillary sinus. So, this opening of the maxillary sinus is on the medial side which is communicating with the maxilla, right. And then we have this particular bone, most medial bone over here we call them as incisor teeth, then we have the canine, then we have the premolar, molar, etc., etc. So, we call them as incisive fossa, incisive foramen, canine fossa, canine element like this. So, there are several general features of this particular bone are there, but as you can see we do not have a detailed morphological understanding on this. Knowing the parts of it which is two of them, body, process 4 of them, holding this particular bone in anatomical position, knowing about this particular sinus and the opening of the sinus we call them as opening of maxillary sinus. If you do not remember the maxillary antrum or maxillary opening of the maxillary antrum, just don't go for it, you just mentioned it, opening of the maxillary sinus, which is equally good for understanding what you are trying to mean, right. Out of the air sinuses, that means nasal sinuses, whatever the sinuses we are having, that means whatever the expansions from the nasal cavity we have towards the frontal bone, towards the maxilla, towards this ethmoid bone, this maxillary air sinus is the largest one. So, this maxilla have got this particular sinus, which is the largest one that we have, and this is the only sinus that we are born with. Later all the sinus slowly develops as we are progressing through ages. That means, more we vocalize, more this nasal mucosa invade towards the nasal mucosa and neighboring bones towards the sinus. So, once this particular maxillary sinus we are born with, that is gifted, then we develop few more sinuses. So, after we are born, we develop the sinus in the frontal bone, we call them as frontal PNS. We develop this sinus which is present in this particular sphenoid bone, we call them as sphenoidal sinus. We develop a sinus in this particular bone, we call them as ethmoid. So, we call them as ethmoidal ear sinuses, which develop later on, but we are the given with this particular sinus when you are born, and this is the largest of all sinus. Clear? So, knowing the basic parts, knowing this particular holding the bone in anatomical position is the basic thing, and then we have to know about the detail of like that particular part. That means, if you are saying this particular bone as frontal process, what do they articulate with? Frontal bone. If you are saying this is zygomatic process, what they are articulate with? Zygomatic bone. If you are saying this particular thing is a nasal process, what they are articulating with? Nasal bone, lacrimal bone. If you are saying this is palatine bone, that means what they are articulating with? Opposite side palatine bone. So, that means this hard palate is formed like this, palatine bone which is making this. If you are saying alveolar process, what they basically hold in here? It's a tooth, the socket for the tooths are there. So, this is basically making the upper lip, and the sinuses which is present in between this particular upper table and lower table, upper table of the mouth cavity and lower table of the orbit. So, if you have any tumor within this particular maxilla, it can erode this particular orbital plate or orbital region. We can have this particular floor part of this orbital cavity damaged, it can erode down as well. So, you can destroy this particular palatal bone, then this particular palate will be exposed. Then what happens? Food material can get into the spaces and elsewhere. So, you have to understand this particular point. So, this is about this particular bone, and this particular bone is also related to some kind of spaces, we call them as fossas. So, we call these fossas as like temporal fossa, infratemporal fossa. Temporal fossa is above here, we call them as temporal fossa. So, below the temporal region we have the fossa, we call them as infratemporal fossa, and deep down we have a fossa, we call them as pterygopalatine fossa. So, this particular bone is related to the two of the space. Laterally it is related to this part, we call them as infratemporal fossa, and medially deep inside it is related to a space deep inside, like deep to it we have a space of fossa, deep space, we call them as pterygopalatine fossa. So, they are kind of little bit deep. So, this is about this particular spaces, but generally talking about this, we have this particular 4 process and 1 body, and surfaces are also 4, that you can also remember: anterior, posterior, lateral and medial, and inferior surface. And this particular posterior one have got like a lateral and a medial part. Medial part is related to the nasal part of this bone, nasal cavity, and which has a hiatus or opening for the sinus. What sinus is this one? Maxillary sinus. Maxillary sinus. What is a maxillary sinus? What is a maxillary sinus? Paranasal sinus. What is a paranasal sinus? What is a paranasal sinus? Expansion of nasal cavity into nearby facial or cranial bones. If it is going to the cranial bones like frontal, we call them as frontal air sinus. If it is going to this particular ethmoid bone, if it is going to sphenoid bone, if it is going to the maxilla, out of this paranasal sinus, largest one we are born with, other paranasal sinus we develop. What are the use or what are the functions of the paranasal sinuses? Increase the area size of air flow in. So that we achieve what? By increased area we achieve what? If you increase the area of this air flow, what we achieve? So what we achieve with this increased area? Huh? Jore bol. I don't have any gun, neither knife. I am not going to shoot you. Increased ventilation. Increased ventilation helps in voice, helps in voice production and vocal resonance. Yes. What else? What else? আর কি হয়? কি হয়? থাকে কিটা বনে? What helps we get it? So find a book, find an internet, write the name of the paranasal sinuses, role of paranasal sinuses, which paranasal sinus has the largest volume, which paranasal sinus commonly gets infected, an infection of paranasal sinus is called dash. 5 minutes, find that. 10 minutes, okay, 10 minutes, find it. Is acutely happening, acute sinusitis. If it is happening for the longer period of time, we call them as chronic sinusitis, right? Chronic means more than 6 weeks, 8 weeks, অনেক দিন ধরে হচ্ছে তখন chronic হয়ে গেল, right? Now, what is sinusitis? That means we have this particular sinus lined by mucous lining. এই যে dead bone টা দেখছো, এর inside cavity টা কি আছে? Carpeted by mucous lining. Mucous lining মানে কি? Mucosal cells থাকছে, epithelium থাকছে, epithelial cells থাকছে, তারপর secretion থাকছে. So if you have infections, bacterial infections, viral infections, these cells becomes irritated. If this mucous cells gets irritated, what it does? It secretes mucus. Now, if they secretes mucus, what happens? This air cell gets filled up with what? Mucus. Normally, it filled up with air. And then what happens? It filled up with water, mucus. If the mucus stays for a long time, it becomes thick. So air gets out and mucus gets water gets in, and that becomes thick water. Now what happens to that particular actions of this paranasal sinus? Will it be heavy or it will be light? Heavy. So it will be heavy. So you feel head like a heavy head if you have cold infections. Do you? Mada bhari lage? Keno lage? So this is what that happens because the sinuses gets filled up with something else. Normally it was air. Air is weightless. Then it fills up with the water, that thick water. And if it thick water becomes for a long period of time, it becomes dirty. That means it gets infected. If it gets infected, then we have what? Infection hole ki hobe? We have pain, we have fever, we have malaise, we have so many symptoms with it. So where the pain will be there? If you have sinus infection in the maxilla, patient কোথায় pain বলবে? কোথায় বলবে? chin region এই জায়গাটা বলে ব্যথা হচ্ছে, কেমন একটা কষ্ট হচ্ছে. If you have frontal air sinus infection, what the patient will complain of? কপালে ব্যথা, headache. If you have ethmoidal air sinus, it's deep. So patient will complain of eye problem, movement of the eyeball becomes painful. If you have sinus infection in this particular deep inside to this particular sphenoid, which is even deeper, we have the same problem, deep throbbing pain, which is deep piercing pain, you will be experiencing that. So the nerve and this particular region which is taking this particular sensation will be in the face region. Which nerve supplies? Facial nerve supplies sensory. What are the branches of trigeminal nerve?